Kia ora, my name's Janet. I'm one of the diabetes midwives, and today I'm going to show you how to test your blood sugars. It's very important to test your blood sugars when you've got diabetes in pregnancy, because this provides us with all of the information that we need to recommend treatments and doses of treatments for you. So unfortunately, we do ask you to test your blood sugars from now through to the end of pregnancy. But once baby's born, you can put your meter away and stop testing. It's an amazing thing for you to do. It's an amazing commitment for you to make to your healthy pregnancy and to your baby to do this. So thank you very much for your effort. We'll provide a prescription for you to get a meter, and you can pick the meter up from the chemist. So it'll be in a box, and inside a little pouch that has got everything you need. So everything you need for testing your blood sugar is a meter, a Lancet, the Lancet device, and the strips, the blood glucose testing strips, and a little book to write your results in. So I'll just talk a little bit about blood sugars first. So during pregnancy, our targets for blood sugars are a little lower than outside of pregnancy. We want you to test your blood sugars 4 times a day. The first test is a fasting test. This is the first test that you do when you get out of bed before you've had anything to eat or drink, usually in the morning. Test your blood sugar before you do too much exercise, because exercise can also make your sugars go up a little bit. So this is the first test in the morning, the fasting. The 3 other tests are after your main meal. So it's 2 hours after breakfast, 2 hours after lunch, and 2 hours after dinner. And this is from the start of eating, so when you first put the food in your mouth. So this gives us a picture over your whole day as to how your sugar is processed, and it gives us the information that we need for your treatment and adjusting your treatment. So I'm going to show you how to load your Lancet. This is your Lancet. The grey cap unscrews, and into the grey cap you put the little Lancet device. Push it in firmly and then twist, and the cap will come off. Does have a little sharp end, and this is how we obtain the blood sample. So replace the cap by screwing the grey end back on, and it clicks. There's a little white end, and this has numbers on it from 1 to 7, and this influences the depth of the sample. We usually suggest that you put it on 3, but you can put it on 2, 4. However, it is comfortable to receive to obtain your sample. To load the Lancet device, you pull on the end. There's a little window here, and when the Lancet is ready to receive a sample, it will be red coloured. Once you've got your sample, that little window goes to green. And you've got a little button here that when you're ready to take the sample, you push this button. Of course, to take the sample, the Lancet has to be resting up against the skin. So where do you take your sample from? We only use fingers. We don't use any other part of the body, and this is to give some consistency. It's better if you use the side of your finger, because it doesn't contact surfaces quite so much, and therefore it doesn't hurt so much. Use alternate fingers each time you take a test so that it doesn't get too sore. It's really, really important to wash your hands before you take the test, because any residue on your hands can contain sugar, and that can make your blood sugar rise. I was talking to you about the targets that we're looking for. So your fasting, we want to be less than 5. 2 hours after your meal, we want the target to be less than 6. So I'm going to now show you how to take a sample. I've got the Lancet device in the Lancet, and I'm going to pull the end so it's all loaded. I've already washed my hands, so they're nice and clean. I'm going to take a strip out of the little box, and on the end of the strip there are 3 black stripes, and that fits into the end of your meter. Once the strip enters the meter turns on and will give you a picture of a drip of blood going onto your strip, so you're ready to take your test. Hold the Lancet device firmly against your finger and don't think too hard about it, just push that button. Wait for a couple of seconds. Sometimes you just have to give it a little gentle squeeze. You don't need much blood. The blood is fed into the end of the strip, not on top, so it goes to the end, and it gives a little noise when you've got enough sample. The meter will count down from 5 back to 0 and give you your reading, which mine is 6.1 because I've just had something to eat. And when you've removed the strip, the meter will turn itself off. So it's important to do this blood sugar testing 4 times a day. As I said, it gives us the information for what treatment's going to suit you best and how to adjust the treatment. It will enable you to adjust your treatment later on in your pregnancy when you're more confident with the procedures. So give it a go and let us know how that goes for you.